By now, most people are aware of this fact. If you have ovaries, the ability to get pregnant using the eggs in your ovaries goes down as you get older. Judging by the messages that we get here at Infertility TV, people still have a lot more specific questions. For example, how fast does fertility decline? What age does it start to go down? Does it drop off suddenly at a certain age? At what age am I no longer able to get pregnant? Stay tuned and I will answer all these questions. Two major factors determining your current fertility are how many eggs you have and their quality. The eggs in your ovaries started forming while you were a fetus inside of your mother's uterus. While you are a fetus, the number of eggs rapidly increases into the millions. However, about 3 months before birth, all of the egg production stops. From that point, the eggs start degenerating. As a result, the older you get, the less eggs you have remaining. That is problem number one. Time takes its toll on your eggs. The longer your eggs have been sitting in your ovaries, the more their quality declines. Lower quality eggs are less likely to produce a pregnancy and more likely to result in abnormal embryos which can miscarry. That is problem number two. We know that this decline starts before you are born, but when does it first become a problem? In other words, when does it first start to become harder to get pregnant? To answer this and other questions, we can look at 3 different types of studies. Study number 1, general population numbers. We can look at a group of people and ask what percentage of people are getting pregnant at various ages. This is relatively easy to do, but one problem with this type of study is that it can't take into account who is trying to get pregnant. Let's say we look at a group of people and determine that there are less pregnancies in 45-year-olds compared to 25-year-olds. Is that because their fertility is lower, or because not as many 45-year-olds are trying to get pregnant? Study number 2, IUI studies. Older couples don't have intercourse as often as younger couples. This may lower their chances for pregnancy. To remove that variable, we can make sure that everyone attempting pregnancy is being exposed to sperm at the time of ovulation by looking at people having an intrauterine insemination, or IUI. An even better group to study are people using donor sperm. This reduces the chances that sperm problems are causing fertility issues. Study number 3, IVF. In several countries, programs that perform IVF are required to report pregnancies along with information about the patients, including age. Since IVF is a common treatment, we have very large databases that allow us to look at the impact of age. Okay, question number 1. When does fertility start to decline? Fertility starts to decline in the early 20s. When we look at various populations, we see that the chance for pregnancy starts to decline from age 20. It is a gradual and steady decline. Some of this may be due to factors other than age. If we look at IUI pregnancy rates, we also see a decline from the 20s, but it appears to be more gradual. If we look at patients doing IVF, pregnancy rates are pretty similar until the early 30s when they start to decline. Question number 2, is there an age when fertility drops suddenly? For our population that is not using fertility treatment, there are 2 time points when fertility decreases a bit more rapidly, at age 20 and age 35. The changes are pretty subtle, however. For IUI, it drops off more rapidly after age 39 or 40. The same is true for IVF, but again, this is not as dramatic a change. Question number 3, is there an age beyond which pregnancy using your own eggs is no longer possible? That is hard to define, so let's say the age at which it is really unlikely to be able to get pregnant. For this population, beyond age 45, pregnancy was exceedingly rare. This was mostly true for IUI and IVF as well. Our Infertility TV bottom line is this: if you have ovaries, the decline in fertility starts in your early 20s. It declines fairly gradually, so that by age 45, it is pretty rare to be able to get pregnant on your own. If you are doing fertility treatment with IUI or IVF, fertility is preserved a little better until maybe the late 20s or 30. It then starts to decline more rapidly, and it gets pretty difficult to get pregnant after age 45. Infertility TV is your most trusted source for accurate information on infertility and miscarriage. If you are not a subscriber yet, hit the subscribe button right now. A new episode is released every week. Don't miss any episodes. You can also check us out on our website, ivf1.com, where you can become a patient.